Hi, everybody. I'm Michelle Morris from Consolidated Planning Group. Thank you all for joining us today. It looks like we've got a lot of people in the chat box here in Texas. Consolidated Planning Group is based in Houston, Texas, but just FYI, we can work all across the United States. So it doesn't matter if you're in Houston or El Paso, Arlington or Midland or San Antonio or anywhere in between. If you know somebody who is outside of the state of Texas, please don't hesitate to share our information with them because we can help families all across the United States. A couple of little housekeeping items before we get started today. I want to let you know that we do record all of these webinars. And after we present the webinar, we are going to go ahead and email those to you if you've registered and you've given us your email address. Later on today, you should receive that email with a link to the recording, and it will also have the slides that I'm presenting. So if there's any links or information that you want to write down, you don't have to worry about taking copious amounts of notes because you will get the recording and the slides. Now, we're in webinar mode, and that means that I cannot see or hear the audience. But you can still send me messages, leave comments and questions just by using the chat box today. And that makes it really easy for me to watch the chat box while I'm also presenting the information and be able to answer your questions without missing too much. You might see I get distracted or something trying to read a question, but pretty much I can handle it. So without any further ado, I will just jump into this. We should be here for about an hour, so feel free to drink your coffee or water or whatever you have and eat your lunch or snacks. I can't see you anyway. So Consolidated Planning Group. Like I said, we're located in Houston, Texas, just outside of Houston, and we serve families all across the United States. We want to be your one-stop financial advice company. I wouldn't say person because we have 4 financial advisors that all work as a collaborative team for every single client. So you get the whole firm. Even though we are small but mighty, and we are able to give people a very well-rounded picture of what their future financial picture will look like, especially understanding the fact that you have an individual in your life that might not be able to be completely independent. They might not be able to have a job that's going to provide enough money to pay for their housing and their future needs. So they're going to be relying on you, mom and dad, or aunt and uncle, or grandma and grandpa, or guardian or adopted parents. They're going to be relying on your help to get them through and to be able to help support them for the rest of their life, not just the rest of your life. And so that's where we really shine at Consolidated Planning Group, is helping families look at the full picture. What do mom and dad or guardians or whoever is the adult, what do they need for their retirement? What do you need in terms of life insurance and your investments? And how does all of that corroborate with what your child needs in terms of them being taken care of? That's why we work so hard to educate the public about different resources and benefits, because that lessens the child's reliance on the parent. It lessens how much money you're going to have to leave for them and for their future. So when we meet with clients, we spend a lot of time looking at both sides. The special needs planning in terms of, like we're going over today, what benefits are available? Do you need an ABLE account, a special needs trust? What legal framework do you need in place for your loved one? And how do you leave enough money to them in a way that doesn't jeopardize their state and federal benefits that we're going to be talking about today? But we also talk to families about, how does your retirement look? What would happen if you passed away early or became disabled and you couldn't work? What if you want to work 2 more years or 3 more years, or stop working at age 60? How would that impact your financial future? What if you want to set aside money for travel or a budget for automobiles or anything that you want in your retirement? What is your life going to look like with benefits or without? With leaving enough money for your child or without? What's going to happen if you were to, um, if your life were to end now before you've planned? These are scary, scary thoughts. And we try to present this in a respectful way, also a little bit lighthearted, but by presenting this information, again, we are hoping to encourage and grow and educate the community so that we can be more effective and we can be stronger all together. So this page kind of goes through what I've just said. We work all across the US. We have over 30 years of experience in financial advising. We are also parents. All 4 of the financial advisors at CPG that I mentioned are parents to loved ones with needs. So we not only live this at work, we live this on a daily basis with our own families. We are chartered special needs consultants, members of the Special Needs Planning Academy, and we're also nationally certified Social Security advisors. And the benefit to you is that we can really help you understand all of the nuances of planning for someone with needs. And that's things like a future care plan. Who's going to take care of them when you are not able to do it anymore? Protection plans for your family. We help families with planning things like the ABLE account and transition periods. What happens when they turn 18 or graduate from high school or move to their next residential situation, or when you as the parent pass away. There's a lot of transitions we need to think about in your loved one's life. We help you with that future cost of care estimate, how much needs to be in that special needs trust without overkill, right? Because you need that for your own retirement. State and federal benefits and local resources. And it's kind of rare to find someone like us, because we truly cover both sides. And it's, most financial advisors only cover the financial side of the house. There are fewer than 200 financial advisors across the United States who also will plan for the special needs side of your house like we do. And that's less than 0.1% of all the financial advisors. So you are truly in the right space when you're with Consolidated Planning Group. We give out lots and lots of free advice, and we're here to help. So a couple of bits of advice we always want to pass on before I jump into the government benefits that are available out there. We're going to talk about, we want you to start planning early. Now is the right time to start your plan. It does not matter how old your child is or how young your child is. The best time to get started is when you have a long runway. That will make it so that small incremental changes that you want to make are going to have a larger impact. Plus, burying your head in the sand and pushing things till later, procrastinating, is never a good idea, because we simply don't know what tomorrow holds. We don't know when we're not going to be here. Maybe tonight I'll be crossing the street and get taken out by a bus. Nobody knows. So you have to have certain things in place before your time comes. Research and explore options early. Get things in place so that when it is time for you to go, things will fall into place behind you. Nobody's going to replace you or be able to fill your shoes completely. But you can do so much now that will make that so much easier on your family when that time comes. So definitely think about what's going to happen after high school. You don't want your child to graduate to the couch. But maybe a 4-year college program isn't right for them. So maybe they can find a shorter program or some kind of certificate program, or find a job where they can work, but they don't need to go to school. Maybe School is completely out of the picture, and we need to look at a residential option or a transition or day program for your loved one. Maybe they just need help finding a job that will suit them and some job training. There are great programs out there for after high school for all of those options. But some of those programs are going to have a waiting list, or it's going to be hard to, find a benefits counselor or a caseworker who is tuned into you and your needs. So think about it early, get on those waiting lists, plan ahead, tour the communities, tour the school campuses, do what you need to do to make you and your loved one comfortable. And be very, very careful when you're thinking about that big question that keeps parents awake at night. Who is going to take care of your loved one when you can't do it anymore? A lot of people just think, oh, it'd be so easy if older sister Sarah can just take care of little brother Jacob. Well, that can cause problems on both sides of that relationship. So just think very carefully about that situation and the drama that could come from it, the feelings of resentment that could come from it if you're not careful. So today, as we're talking about Government Benefits 101, again, I want you to put any questions or comments in the chat box. I do have several questions that were sent in ahead of time, and I'm going to get into those as much as I possibly can. But we're going to be talking about the state waiver programs, SSI and SSDI, Medicaid and Medicare, how and when to apply for these benefits, and also a little bit about ABLE accounts because they can help too. But like I said, as we're going through, whatever questions you have, just put them in the chat box. So let's start with a general timeline of how these state and federal benefit programs should look for you. First of all, at some point in your life, you're going to get either a diagnosis or you're going to think, something is not quite right here. We might need to talk to the doctor about what we're seeing and our concerns and see if there is a diagnosis. I would say that as soon as you know that there is any inkling that there might be something going on, work very closely to have everything documented with your doctor. Make sure everything is in the medical history as much as possible. What are your concerns? What are you seeing? What does the doctor see and what do the tests say? Now, as soon as you have a diagnosis or even a suggestion, an idea that there might be something, you should go ahead and get on the waiver program wait list here in Texas. Now, other states, it's not as important that you get on as quickly as here in Texas, but you can apply for those state waiver programs at any age. So you do not have to wait for your child to turn 18. You don't even have to have proof of their diagnosis when you put them on the waiting list. All you need to do is give them your child's name, contact information, social security number, things like that, and they're going to be put on the waiver waiting list. Now, when your child comes up on the list is when you have to prove that they qualify. And we'll talk about those waiver programs more in just a few slides from now. So hopefully you're able to do that when your child is younger, because like I said, here in Texas, the wait is so long. You really want to make sure you do that as soon as possible. But even if you're in a different state where there's a short wait list, you would want to receive those benefits and services as quickly as possible. Now, SSI, typically, people won't qualify for SSI until the individual with needs turns 18. The reason is before age 18, the government is looking at the parent's income and assets to determine if the family gets SSI benefits. When the person turns 18, all of a sudden they're only going to look at that person's own assets and income. So the income and asset limits are very low. We're going to talk about that and talk about how to qualify for SSI. Later on in this timeline, and this is ideal, other things happen, especially with SSI and SSDI. SSI, like I said, hopefully will start when your child turns 18. They're going to get a check, a monetary benefit, and they're also going to get Medicaid. Now, as your child ages and as you as the parent age, eventually when you're in your 60s, in an ideal world, you'll turn on your Social Security retirement benefits. When you turn on your own Social Security, your child can go from SSI to receiving a benefit based on your work history. When they do that, they'll lose SSI, but they'll be able to get more money, and they will also eventually be eligible for Medicare. Um, in certain situations, a parent passes away or becomes disabled when the child is still a minor. We just need to be careful when that happens and try to see if we can still get you Medicaid. Because sometimes if you turn on the SSDI or childhood disability benefits or RSDI before you get SSI and Medicaid, you might lock your child out of ever getting Medicaid until they get the waivers at least. So just be careful and consult with an expert before you turn on your benefits or your child's benefits, and we'll walk you through it. All right, so I already have a question in the chat box. Let's see if this is something for now or for later. I have taken over caregiving for my cousins due to my aunt, who is their mom, passing away. She did not document anything for them. So how do I determine where they are on the waiver wait list? I do have some advice for you on that, Jenna, and that's going to come up in a little bit. So just hold tight on that question. I'll make sure I get to you. So the waiver waiting list. How do we get on it? So each state has their own waiver programs. These phone numbers are for Texas, but no matter what state you're in, you can just Google, Oklahoma waivers for children with disabilities or whatever the situation might be. And you want to find out who to call and get on these waiting lists as soon as possible. Some states have very, very long waits, like here in Texas. The wait list for these programs can be 17 to 20 years. In some states, you just move there and prove residency, which is, I think, 6 months in most cases, and you can get benefits. Now, I am not passing any judgment on this statement that I'm about to make. I'm not sharing an opinion one way or the other. But what we have seen, especially recently, is that states where they have legalized marijuana typically are using the tax funds from the sales of marijuana to help fund some of these programs for special needs kiddos. So if you're thinking about a move and you're looking for a state that has a short wait list, you definitely want to check out some of those states that have already legalized marijuana. Now, I'm not saying, like I said, whether that's good or bad, whether I do or don't or believe or not. I'm just saying that that is a fact. Now, here in Texas, there are 3 different places you can call to get on the waiver waiting list, and you do have to make phone calls to get on the list. First of all, for MDCP, class, and DBMD, you're going to call 877-438-5658. Now, those are 3 different waiver programs. We're going to get into what each one of them are. But I want to tell you that everybody who is in this call should call that phone number, because MDCP and DBMD are both very narrow waiver programs. They only serve very specific people. However, class serves almost anybody with almost any disability. So if you have a child with any diagnosis, you should call to get them on the class waiting list. And again, that phone number is 877-438-5658. Now, next, you want to call your LIDA. That's your local intellectual and developmental disability authority, your LIDA. That would be something like Bluebonnet, MHMR, ACOG, Texana, Harris Center, I'm not going to list all of them, but you might have heard some of those names. If you've heard those names, that's your LIDA. If you don't know who your LIDA is, you can look it up online. The link is there on the page. Or you can just call 211. That's the shortcut phone number for Health and Human Services. And they'll tell you who your LIDA is. So you want to call your LIDA and tell them that you want to be on all of the waiting lists for all of the waiver programs and for Community First Choice. Now, the third phone number here is for Star Plus. Star Plus serves our age 21 and older community. So if your loved one is 20 or 21 or older, you should be calling for the Star Plus waiver as well as the other two that you've already called. And their number is 877-782-6440, or you can find them online. Now, once you make these calls, and Jenna, this is where you want to pay attention. Once you make these 3 phone calls and they get your loved one into the system, you can go to yourtexasbenefits.com. You're going to create an account under your loved one's name and their contact information, and then log in as them, and you go to manage and then look for interest lists, and it will pull up a list of which lists you're waiting for and where you are. It might say, you're number 6,000 out of 243,000 people who are waiting for this, or whatever the case may be. It doesn't say, a countdown in terms of time, but it does give you at least your place on the list and shows you which lists you are already on. Okay. That's yourtexasbenefits.com. All right, so let's talk about these different waiver programs and which ones might work for you and which ones would not. These 4 programs that I have up on the page right now are very general. They serve a lot of people. For example, with CLASS, you have to have a disability that started before age 22. But other than that rule, CLASS pretty much serves anyone with any intellectual disability or related condition. And there are over 200 different related conditions. As long as this disability affects the person's ability to function in daily life, and it started before they were 22 years old, you're going to be on the CLASS waiver waiting list. HCS gives services and support to children and adults with an intellectual disability or a related condition. These are people who are going to be living in their own home with their families, in their own home by themselves, or in a small group home, no more than 4 people. You get HCS. CFC, that's Community First Choice. Community First Choice is for people who are already on Medicaid and will help with activities of daily living and health-related tasks. They can provide hands-on services. And this one's a little bit different. We're going to talk about this one, I think, in a few slides. If you have more questions about waiver programs, we do have an entire webinar dedicated only to the waiver programs. So you might want to flip back to our YouTube channel and check that one out if you have further questions about the Texas waivers. But Community First Choice is an entitlement program. It's a little bit different. You don't have to have that long wait for CFC. Finally, we have Texas Home Living. Sometimes people refer to this as HCS Lite. It gives, again, adults and children with intellectual disability or any related conditions. You have to live in your own home or your family's home, not in a group home setting, because they just simply don't pay enough. HCS has the biggest budget of all of the waiver programs. We kind of think of it as the luxury car of the waiver programs for that, because of that benefit. Okay, some of the more specialized programs. These are not for everybody. They have way shorter wait lists because of the fact that they're not for everybody. So first is DBMD. If you have a person in your life who is deaf, blind, and has another disability, they can qualify for DBMD. Just a quick note, blindness also gives people in terms of how much in assets they're allowed to have, how much in income they're allowed to make. You are allowed to have and make a little bit more if you're blind. But anyway, DBMD is a waiver program that is meant for people with all three of those conditions, or if you have a disability that is leading to complete deafness and blindness, and another disability besides that. MDCP, again, a narrow program. This only serves those people who are especially medically fragile. We often hear, well, our name came up on the list for MDCP after only a year or two, but they determined that our child was not fragile enough or medically dependent enough to be able to get this program. This is for people who are 20 years or younger, and it keeps them from needing to go into a nursing home or a 24-hour care situation. The YES program, this one is meant for people who have, as their primary diagnosis, first of all, has to be their primary diagnosis, and they have to be under age 19. Their primary diagnosis is something mental, behavioral, or emotional. And then they might also have, ADHD or autism or something else besides that. But this is for like our bipolar community, schizophrenia, things like that. And then finally is STAR Plus. And that, as I mentioned before, is a program for people who are age 21 and up. This is when the children who are on MDCP hit age 21, they're supposed to just automatically shift over to the STAR Plus program. And that's going to be able to continue serving that community of medically dependent people. All right, I think I got those questions under control. So let's talk about the next step. We've signed up for waiver programs. We know an overview of which ones my child might qualify for. Now let's talk about the next wave of benefits that's going to come that we need to think about. Because you can sign up for those waiver programs as soon as you know that there's anything going on. SSI. So again, SSI, this is a taxpayer assistance program. It's a public program that is funded through our taxes, and it serves people who have a financial need because they are unable to keep a job that is going to fulfill their requirements or be able to sustain them because of the disability. So there are three main criteria that they look at to determine whether or not you get SSI benefits. The first criteria is the disability. You have to prove that there is a disability. You also have to meet income and asset limits. This pays monthly benefits to people who are disabled, blind, or elderly, who have limited income, limited resources. The maximum resource that you're allowed to have for SSI is $2,000. Now, if you're married, you can have $3,000, but this is crucial that you keep the child's bank account below $2,000 because of this. On the other hand, SSDI. SSDI is the benefit that is earned through paying into the Social Security Department for all the years while you're working. Now, if we have an individual with a disability who is unable to earn enough work credits to get their own Social Security plan, their own Social Security retirement benefits, they can go off mom and dad's or grandma and grandpa's, step parents, anyone who has adopted them. you can use their benefits. It's not just it's not based on your personal assets and income limits. You don't have to worry so much about those with SSDI, but it does require that somebody in this child's life has earned enough work credits to get a Social Security retirement. It's based on the parent's work record. Okay, so let's talk about that eligibility. Let's dial in. You have to be considered disabled in the eyes of Social Security. We talked about that, right? You have to have less than $2,000 in assets, $3,000 if you're married. That means in a bank account or in anything that you're able to get access to that money and use it as you wish. Now, this does not include money that is held in an ABLE account or in a special needs trust. So $2,000 limit on the bank account, $3,000 if married, working less than SGA. You are allowed to work and still get SSI as long as you stay under the substantial gainful amount. Now, these numbers change a little bit each year, but for 2026, you are allowed to earn $1,690. If you're blind, you are able to earn $2,830 before you would lose SSI benefits. You are also allowed to have one house and one car. So for any parents who are thinking about leaving a house to their loved one, that's fine. It doesn't even need to be in a special needs trust. You can leave a house to a loved one, and it does not count against their SSI benefits. Now, there's other things you need to think about if they can keep a house and pay taxes and pay insurance and all of that, but that's a whole nother day. So how do you file for those SSI benefits? You need to apply in the month. Actually, we've heard the month after your child turns 18. So if your child is, maybe their birthday is June 17th, I don't know, June 17th, go ahead and apply for SSI benefits on July 1st. The first day of the next month after your child was born is going to make sure you're safe. You're going to go online, create an account for your loved one, log in as them, and create this SSI application, right? That will backdate your payments. Even if it takes a year for them to get your application approved and finalized, they're going to backdate your payments to the date you started the application and be able to pay you, okay? There's a link right there that you're going to be able to click later to start your application. So question in the chat box, is the SGA amount total or monthly? That's a monthly. So let me go back to that slide right here. $1,690 per month. I'm going to add that on that slide. Thank you for bringing that to my attention. Not per year. Now, yes, these slides will be available later on today. I see another question. What if an individual has worked and earned work credits, but then the work became too much for them? Can they still reapply for Social Security? Yes, in certain cases. So there is something called the Ticket to Work program, and there are various phases of work. It's trial work period, and then the extended trial period. And then if you can't make that work, they would put you back on SSI. But if you work for so long, then it's complicated. And I would love to tell you all about it. Go ahead and make an appointment with us so that I can explain it all. Okay. Okay. So once you apply for SSI benefits, you're going to have some evidence to prove different things. And this is what the application kind of asks you about. You're going to have medical and educational records that can help prove that there's a disability that started before age 22 is better. If it's a disability that started after age 22, you can still do that. So don't worry. It's just for some benefits, right? You're going to have your child's medical providers. If they haven't been to a doctor in a long time because they've been healthy overall, you might want to just go get a checkup at least before you apply for SSI. But you're going to want the names, addresses, phone numbers of any treating physicians, hospitals, diagnoses, a list of the medications that your loved one is on. And you're going to want to have their financials. If they've worked, you're going to need pay stubs. If they have a bank account, you need bank statements. All of this happens when you're applying for SSI benefits. You might want to consult with your child's primary care physician and find out what is in that medical history. Have they done enough of that documentation that we mentioned at the beginning to really paint a good picture of what life looks like for your loved one on their worst days? This is not, when we're looking at the SSI application, we don't want to use words like, oh, sometimes they have this and sometimes they can't do that. We want to picture what life looks like for them on their worst days, when they need help, when other people wouldn't necessarily need help. So look at the primary care physician's medical records and compare that information to the Social Security Blue Book. This is a link, and what you can do there is you can go to any diagnosis that your person has and look up, for example, ADHD, anxiety, depression, whatever it might be, and find what are they going to look for to have as proof that your child has this need. Well, for example, if you say that your child has an intellectual disability, they're going to say, okay, does your child have an IQ below 70? And if you say no, they're going to say, well, okay, does your child have an IQ below 75 and another diagnosis? And if you say no to that, they're going to say, well, we're not quite sure that your child has an intellectual disability. But if you have 5 diagnoses and they're all borderline, they'll take that into consideration. Okay, so it will show you in the Social Security Blue Book what they're looking for, and you can use that to gauge if you have sufficient evidence. Be prepared to sign an authorization form for your child, or having them to be able to have them talk to you at the Social Security Department. That's an SSA 1696, because if your loved one is over age 18, which they should be if you're applying for SSI, right? You need to have some documentation that's going to allow them to talk to you. Now, what do you expect? When you apply for SSI, what's going to happen? Well, first of all, it's going to take over a year, sometimes even longer, for you to get your approval, unless your child has what they call a presumptive disability. This is a link again. It will take you to a list of what they consider presumptive disabilities. Sometimes they refer to this as a compassionate allowance. For example, IQ under 70, you're going to get approved. Cerebral palsy, approval. If you have lost a leg at the hip, that will get you approved. There are various things that they can approve at the local level and not have to really dig into too much, and the process can go a little faster. Sometimes we've heard that people are getting a really quick denial letter, but if you look closely at that denial letter up at the top left corner of the first page, it will say either Social Security Disability Income, that's SSDI, or it could say Supplemental Security Income, that's SSI. If you're intending to apply for SSI, you probably do not qualify for SSDI. So it's okay that you get a letter that says you're denied that benefit. They're still processing the SSI application in the background. They just don't mention that. So again, if you get that letter and you're a little worried, just give us a call. We'll take a look at it for you. Once your local office finalizes your application and they have everything that they need from you, they're going to send everything over to the Disability Determination Services Office. Every state has one. In Texas, it's in Austin. You can call the DDS office and ask, do you have my file? Are you missing anything? Do you need any further evidence or anything like that? Okay. Another part of the SSI application that is kind of interesting, they do offer a part where you can talk about your loved one and lay out where they have challenges, what life looks like for them. And I would encourage you to be very descriptive in those explanations. For example, you wouldn't just say, my child has an intellectual disability. You would say, my child reads at a first grade level, even though they are in high school and their peers are reading at this level. My child needs constant redirection and cannot handle two-step tasks. They must be guided through each step separately. My child cannot understand the dangers of a parking lot. Even though they have a normal IQ, they are not conscious about their safety and would run into a parking lot themselves if not given 24/7 guidance. Things like that you can put into the SSI application. Now, when you get approved, the maximum monthly benefit, the monetary benefit, is $994. If you're married, if you are an individual who has a disability and you are married and your spouse also has a disability, you would think that you would each get your $994, but that is not true. Married couples where there is a disability for both person are penalized a little bit, I feel, and they only get $1,491. Contact your congressman about that. Your state representatives are the ones to complain to. Now, when you do get SSI, no matter how much you get from the program, you do get Medicaid that comes along with it. Even if you work so much or your loved one works so much that their SSI is reduced, as long as they're only receiving $1, they will still get Medicaid. All right, let's look at some of the questions I see here in the chat box. If we're in the process of obtaining guardianship, is it better to wait to apply for SSI or just start now that he's 18? Just start. There's no reason. SSI and guardianship have nothing to do with each other. You can start as soon as, that month after he turns 18. Susan wants to know, is there a required interview if your child's IQ is under 70? Susan, sometimes it's really hard to determine certain things, what is required. We know the criteria. We don't always know their methods. Sometimes it seems like the Social Security office will want to interview you and your loved one if you're already receiving benefits or if your loved one is kind of borderline. Some say if it's a low IQ, they're kind of on a case-by-case basis over there. And it's really hard to predict what they're going to say. And sometimes it's hard to predict even if you're going to call the Social Security office and even get someone who knows what they're doing. So I really can't predict that for you. I'm sorry. Last question, then we'll cover a couple more slides and then go back to questions. Jenna wants to know, where do you go to get an IQ interview, or does Social Security conduct this? To get your child's IQ tested, that's what we're talking about, is we want to know what their IQ is. So that can be done. You would ask your medical providers where you could have that done, or the schools. Sometimes it happens through school or a doctor or a psychologist or something like that. Okay. So remember, there are certain things that impact how much money you get from SSI. One of those things is working. If your child is working, they can earn up to $1,690 a month, $2,830 if they're blind. But the SSI benefit will be reduced. And this equation kind of shows how they reduce the benefit. So basically, if you're making about $1,200 gross monthly earned income, they're going to immediately ignore $85 of that. That's just general exclusions that come off. So now we're down to $1,115. You divide that number by 2. That brings us to $557.50. That's your countable income. And you subtract that from the total amount you could be getting, which is $994. And whatever is left over is what you should be receiving in SSI benefits. So basically, if we ignore that $85 initial deduction, it's about for every $2 your child makes, they will lose $1 in SSI benefits. There's another thing that can impact that, though, and that is a student earned income exclusion. Basically, you can get more exclusions, more than that $85, if your child is going to school while they're working. If they're attending school regularly, which means 8 hours a week in a college or university, 12 hours a week if they're in middle school through high school, if they're in a training class, if they're in being homeschooled, if they're in a tech school, any of those kinds of educational programs regularly, that means about 8 to 12 hours a week, you are able to get the student earned income exclusion. And what that means is that they can earn more without that earnings impacting their SSI. Now, someone's asking in the chat box, what about a day hab? Well, if they're being trained for employment, if this is a training course at the day hab, maybe. But if it's just, kind of recreational, that's not going to count. This has to be an educational program. Now, you must call the Social Security office and ask for this. They're never just going to look at your record and say, oh, this child is under age 22 and it says they're still in school and they're working. Let's give them that. No, they're not going to do that for you. You have to ask for it. Okay, another thing that can impact SSI benefits, and I know we're lingering on this, but it is so important. Your child can get nearly $1,000 a month and Medicaid and all the benefits that come with Medicaid. So that's why we're really focusing in on SSI. So child support can have an impact on SSI benefits. Overall, they say the divorce rate in the United States is something like 50%. But when you throw in a child with a disability, that number goes up to about 80%. Child support can continue beyond age 18 if your child has a disability. It can continue indefinitely depending on your circumstances and your judge and your divorce decree. But once your child turns 18, that child support is going to count as income and would reduce their SSI benefit because it would count against that $1,690 a month. So what do? What you can do is have that child support redirected to a first-party special needs trust. The first-party special needs trust will not count against their SSI or Medicaid benefits. There are a couple of drawbacks to that first-party trust. It's not the ideal situation, but of course, neither is receiving child support because the divorce isn't the ideal situation, right? So you need to go back to the court and ask that your child support be redirected to a first-party special needs trust. You might need a attorney who focuses on special needs to set up that trust for you, and then to talk to your divorce attorney or the attorney general to discuss getting the divorce decree changed to have the child support go into that first party special needs trust. If you're proactive about it, that's going to make things much easier. But if the divorce has passed and it's been finalized and you're just learning now, you can go back and make changes to that divorce decree. All right, so this little chart we're going to start talking about this benefit that the child gets based on the parent's work record. Now that disability benefit has several different names. I don't know why, but they're all pretty much the same thing. So this might be called SSDI. That stands for Social Security Disability Income. It might be called CDB, the Childhood Disability Benefit. We used to refer to it as DAC, the Disabled Adult Children Benefit. Some people call it RSDI, Retirement Survivor Disability Benefit. Any way you call it, this chart applies. So when the parent turns on their retirement benefits or their disability benefits, the child can draw a benefit from the parent's record. And that benefit would be about 50% of the parent's full retirement age benefit. So depending on how much you know about Social Security, and we are Social Security experts, we have a plan, by the way, that will tell you exactly when and how to do all this, when to turn on your Social Security benefits to get the most benefit you can for yourself and your spouse and your child, because all three of those people can get benefits based on one parent's work history. Contact us for those details. Anyway, let's say that you as the parent, you're in your late 60s, it's the maximized time, and I turn on my Social Security retirement benefits. I'm going to get a certain amount. My child is going to get half of the amount based on my full retirement age. They have to have been disabled before age 22. And there is a family maximum. So if I have more than one child and a spouse drawing from my Social Security, we might run into that family maximum. Now, when I, as the parent, pass away, my child's benefit is going to go from about 50% up to 75%. And they're going to receive that benefit for the rest of their lives. That's why it is so critically important that we maximize that benefit and get the most that we possibly can for your family. And that doesn't always mean waiting until you're 70 to turn on your Social Security benefits. So definitely talk to us about this and we can walk you through it. For these SSDI benefits, the person has to be over age 18 to receive it. They have to have a disability that started before age 22. That parent has to have been working enough to earn the Social Security. The child must be unmarried. Again, that makes me very unhappy that they put that in there, but the only thing we can do is contact our representatives in the state and complain about that. And you can't have previously earned enough to get your own Social Security disability benefits. That was one of the questions we had that kind of throws things off, but we would dig into your personal situation to figure that out for you. Now, when you start getting SSDI, the SSI, the $994 a month goes away. And then they get this higher benefit based on the parent's work record. You can only draw one SSI or SSDI at a time, and you only get one of your parents' benefits. So whoever turns it on first, you can follow them. And then if the other parent turns on their Social Security later, and maybe it's higher, you can switch over to the higher benefit. So your SSDI goes away, but you do keep Medicaid. Then after you've been on this benefit for 2 years after age 18, you're going to be eligible for Medicare as well. And you'll be dual eligible. You'll have both the Medicaid and the Medicare. You might have to reapply in order to get that. That's the H-1200 form. It's supposed to be automatic. It isn't always. This is a government entity. So questions in the chat box. They have to be a dependent, even though they are over 18. Stephanie, I'm not sure what you mean by that. If your child meets these criteria, that they have a disability, that they're the dependent of the insured worker who has I think we're getting lost in semantics there if we're talking about dependency. But as long as you are providing for them, it fits. Okay. Kiana says, my 18-year-old has cerebral palsy and his social security was is still at the DDS in Austin. I'd like to change his last name. Should I wait? Yeah, you know what, Kiana, just wait on that. Let's get him through the application process with as few distractions to that application as possible, because they take long enough as it is, and now we want to change things on that form. Just wait until they approve them. Okay, so we've talked about SSI, we've talked about SSDI and childhood disability benefits. Let's talk about those ABLE accounts and what that can do for you. So an ABLE account is a tax-advantaged savings plan. You might have heard of the 529 college savings account. This is very, very similar. That's a 529C for college. This is a 529A for ABLE. It stands for Achieving a Better Life Experience. So you can use the money in the ABLE account for anything that helps your loved one achieve a better life experience. The income that is earned in the ABLE account, because there is an investment portion to many of them, that income is not taxed, and that's where that tax advantage comes in. Also, the money in the ABLE account does not count as an asset for your loved one, which would jeopardize their SSI and Medicaid benefits. Now, the beneficiary is the account owner, but still, it doesn't impact their benefits. You can roll this account over to other family members if they also have needs. You can only put in $20,000 for 2026, and you can never have more than $100,000 in that account if you still want to get any SSI or Medicaid benefits. Now, at death, if there is still money left in this ABLE account and your loved one passes away, let me just delete that. Okay, there we go. If there's still money in there, Medicaid can come back and claim reimbursement. Now, the rules for that are a little murky. They can only reclaim certain amounts, and sometimes they don't even mess with it. So there are some details, especially for 2026, that you want to be aware of. They just raised the age for the ABLE account up to 46. So it used to be that you had to have a disability that started before age 26. Now they've moved that to 46. You still have to meet age 22 guidelines for other benefits, but for this one, you can have an ABLE account as long as you have a disability that started before age 46. You can put in $20,000 this year to the ABLE account, no matter who's putting it in. It doesn't mean that mom and dad and grandpa and grandma can each put in 20. It's 20,000 from all sources. There is that able to work provision that says that if you have a job, you can put in additional money above and beyond that $20,000 up to the maximum of $15,650, or whatever you earned at work, whichever one is lower, up to $15,650. Now, if you've earned $5,000 that year, you can add $5,000, not $15,000. Okay. Funds from a 529C, the 529 college savings plan, can easily be rolled over to the ABLE account. A lot of times we see this when a child was diagnosed maybe a little bit later and you already had the college savings set up for them. Now you're starting to see that they may or may not go to college. A 529 ABLE account can still pay for college or educational expenses. It just opens up what it can pay for dramatically. And they are going to start allowing a federal tax credit for 2026 taxes and beyond. They do not give you a state income tax credit in most states. Here in Texas, we don't even have state income tax, so they cannot give you a credit for that. All right, let's check on some. Oh my goodness, we are over time and I wasn't even paying attention. Let me quickly go through this and then I'll look at questions. If you have to go, I understand. Um, this slide goes through the big differences between the ABLE account and the special needs trust. Mainly, the limitations on how much you can put into the ABLE account, whereas the trust has an unlimited amount of money in it. The ABLE account is funded with cash. The trust, you can put any asset type. The ABLE is controlled by the beneficiary. The special needs trust has a trustee helping out with the money. You can use the ABLE account to pay for anything, including housing. With the special needs trust, if you're still on SSI, you should not use it for housing, or there will be a reduction. The ABLE account is tax advantaged. The special needs trust is taxable. The ABLE account has that reimbursement clause that will repay certain Medicaid costs to the state for things that Medicaid paid for your child after you opened the ABLE account. And the special needs trust has no payback. You can leave the additional money in the special needs trust to another beneficiary. All right, questions. Can you use the SSI payments to open and fund the ABLE account? Yes. So what typically happens is kids start getting $1,000 a month for SSI payments-ish. The bank account starts getting too high, too close to $2,000. So you just shift some of that money from the bank account to the ABLE. When you need to spend it, you can simply shift it back into the bank account and spend it as normal. We prefer that you keep things going through the bank account so that you have an easy transaction history. This slide is going to take you to our website to a link. For all of our upcoming webinars, you can pre-register. This is our team at Consolidated Planning Group, and this is how you schedule your free consultation. I'm going to leave this up here while I get the last questions and say my goodbyes, because I really want you to schedule a free consultation, especially with me. I want to chat with you. I want to hear your concerns and questions. I'm putting my own contact info in the chat box so you can schedule. Kiana wants to know, how do you open an ABLE account? First of all, you schedule your free consultation. We will talk you through the ABLE account, what it is, what you need to do, answer any questions you might have about it, and then we can set it up for you. Now, you can also open your own ABLE account. It is perfectly acceptable for consumers to do that on their own, but if you want our guidance, we would do that for you. We do not charge anything for the free consultation or to open the ABLE account. In this consultation, which is on Zoom, we go over a little bit about your family, what questions you might have. We give you some helpful advice based on a questionnaire that we ask you to fill out before the consultation. And then we'll tell you about us and what we do and how our program works. You can use the QR code, you can call or email the office, or you can call or email me directly. And the last thing I'm going to say before goodbye is just please follow us. There's our YouTube channel, our Instagram page. We have a podcast and a Facebook page. Schedule your free consultations, follow us. I hope that you have a great day and that this webinar was at least a little helpful for you today, even though I lost track of time and talked too much. Have a great week, everybody. I hope to hear from you soon. And thank you so much for joining me today and being here for this presentation. Bye, everybody. Bye-bye.